Good morning, everyone. Good morning. Oh, that was a good start. What a response. Sounds like a lot of healthy people. My name is Dennis Greenidge, and I am the pastor of this church. And I have this great pleasure of welcoming you to this WWMF, which means Worldwide Mission Fellowship, Health Screening Day. And I'd like to give a special welcome to, and I'm going to call these people's names out, and when I do, because I want them to feel welcome, I'm going to get them to stand up and pronounce properly their surnames. So first and foremost, we have Dr. Daniel Aville.
Yes, thank you.
Okay. Say your surname.
Abioye. You have to put excitement on it.
Excitement. Amen. Yes, so you always leave his doctor's surgery excited. And then we have Dr. Tosin Ekibekele. Oh. Tell me. I'll have to come and see your doctor. And then Dr. Myra Osinibi. That's why we need doctors. And then Dr. Joshua Fasumi. Is that right? Fasumi. A bit like the Japanese.
Yeah, chop suey.
Chop suey, that's it. Okay. Come on, Joshua. And then we have Dr. Jumie Okoh. Oh. I heard well done. You can be my doctor. And then we have a nutritionist and Nicola Burgher. Thank you, Nicola. And I knew Nicola's dad. Our father was a wonderful pastor, and mum's here today. So we thank God for, isn't that a blessing? And then we have in the house a psychologist, Dr. Danielle Scott. And I always take my issues to her. And at this time, my job's fulfilled right now, but we want to thank God for you all. I'm going to pray in a moment. Before I do that, I'm going to pray now, and then I'll hand over to one of the visionaries, and Dr. Cheryl Clark, and we thank God for her. And so I'm just going to take a verse that means a lot to me, and I know it was when the Apostle John, he wrote to the beloved Gaius, and he was speaking about the faithful blessing that Gaius was to him. And we can really thank God for you all, and all those who will be taking part, the other members of the fellowship that are also going to be involved. I thank God for you all, and we can be in this place, and we thank God because we know that he's not just interested in our spirit man, but the very body that houses that, and of course our soul, which speaks to the mind of our intellect, our will and our emotions. But it says in 3 John 2, "Beloved, I pray that you may prosper in all things and be in health, just as your soul prospers." And I thank God today we're going to have a holistic approach. So let's bow our heads right now as we pray. And I want to pray specifically for our medical workers that are with us today. Father God, we know you are the true and only healer. And we thank you, Father God, because you've expressed your love and your power, Lord, to these precious doctors and all these care workers that are with us today. Father, your heart for mankind has been expressed in them. We thank you for, Lord, setting them apart, even for such a time as this. And we want to thank you for all these medical workers, Lord, who sacrifice time and sleep and family, Lord, in some cases even their lives, to bring healing to those who need it. When people are sick or hurt, they just want to be well and whole. Lord, they come for the knowledge, discernment, and quick wisdom that these doctors use to help heal people, so they can be well enough to be open to hear the good news of the gospel. And Lord, I want to thank you for providing healing for us all. And we want to say, Lord, it is a joy that we can be together. We pronounce your blessings upon this day, and we commend this day, Lord, to your word and to your grace and to your care. In Jesus' name, the Son of the living God. Amen. Let's welcome Dr. Cheryl Clark as she comes.
Good morning, everyone. Thanks for coming, and thank you, doctors, for all coming. It's like a big reunion for a lot of us. Just to just make a quick note. So for everyone that has come today, you would have received a little gift bag. So you've got a little notebook and pen if you want to take some notes. Also, there's a consent form. That form is just to explain some of the tests we're doing would involve a skin prick test. So it's a needle that will make a little bit of blood on your fingertip. You don't have to have it done, but I would advise, if you want to know your blood sugar and your cholesterol, it's advisable. So it's just a sign to say we will do everything in a way to minimize any risk of infection. But you don't need to worry, it's just there to cover as well. And then also on the bottom of that form, it will explain we have about 3 extra different workshops. So we've got observations on this side. Everybody can go and have their obs done. But then for the other workshops, you can only pick one, I'm afraid, because of time. So it's going to be either memory tests, and we kind of recommend that for like a certain age bracket, or if anyone just wants to test their memory, it's fine. You're welcome to tick for that box. Or there's nutrition if you want more nutritional advice, especially if you see your blood sugar's not what you was expecting it to be. And then, of course, we have our educational psychologist here who will be doing some group therapy workshop. So if you just tick which one, and then I will find you and group you up after our talks. So I hope you enjoyed the morning. It's going to start off the morning with presentations from our doctor, our cardiologist doctor, Dr. Daniel, and our GP, and we'll just run through. After the talks, we'll then have a mini break before we do our workshop. All right, I hope you enjoyed the day. God bless you all. Thank you. Sorry. So I'm now going to welcome Dr. Daniel Aville. Thank you. Bless you.
Good morning, church. It's my pleasure to be here. And thank you for the warm invitation as well. And my prayer is that today will be a benefit to your body, soul, and spirit. In Jesus' name, amen. Right, I get to go first. Okay, so I'm going to be talking about cardiovascular health. I'm Daniel Aville. I'm a cardiology specialist, a heart specialist. So we're going to be talking about the risk factors, as we describe them, of heart conditions. So we've divided them into modifiable factors and non-modifiable factors. The non-modifiable factors are the things that you can't change. You know, you can't change your gender, you can't change your family, even though you would like to. And you can't change your age as well, you know. Some of us, we're blessed to look like 20 years younger than you really look, but, you know, those bones don't lie as time progresses. Now, the modifiable factors are the things that we can at least slow down the progression or the significance of the damage they can do to the body. And I'm sure you know all of them essentially. So it's listed on the screen. So we're going to be walking through them one after the other in the next few minutes or so. If you can have the next slide, please. Thank you. So, this is much better than I sent it, isn't it? Thank you, media team. Wonderful work. Okay, so high blood pressure. Silent killer. Because majority of the people don't realize they've got it until there is a significant problem to the body. And this is the reason why this is very important, having the screening check. And of course, going to the yearly checkups with the GP, even if you're in good health, especially our men. So it's not a disease that is limited to the young people alone. And by young, we mean people who are less than 40 years old. And 1 out of 15 people who are less than 40 would have high blood pressure. That is high. So we shouldn't take these things for granted, essentially. We all, mainly or majority of us are of black descendants, low salt diet. We have the tendency to put a lot of salt in food, but our genetics is not able to handle it. So we consume a lot of content that we cannot get rid of. And that is one of the main reasons why people develop hypertension. And of course, one of the reasons why it's more common within the black population. High blood pressure, low salt diet, very, very important. Home blood pressure monitor, every household should have one. Because, essentially, the blood pressure that you measure in the comfort of your own environment is more reliable than the one that you measure at the GP or in the hospital settings, because everybody has the tendency to be a bit on the edge, when you visit the doctors, because of the sort of bad thing they tend to say to you. So have your own blood pressure monitor at home, every household, and as I've said, it's not just people who are old. Everybody's blood pressure should be monitored very closely. Adherence to medications. And I think, it's a very important topic. Coming from doctors, we're not the most compliant anyway. And we know that most of the medication that get prescribed, they end up, in the shelf for several months. So it's important that these medications are taken, especially for high blood pressure, because you don't feel the symptoms. You feel you're okay, you think you can do away with the medicine. So please adhere to your medication and work with your health practitioners as well to help you safe and healthier. All right, I'm going to move on to diabetes now. Again, something that we all know about. Eat well. Very important. Again, diabetes is something that is common within the black community. People from the South Asian world as well, they're more likely to have this disease. So main thing, watch what you eat and make use of that energy that you are consuming. So none of us should have, unhealthy weight. And if you do, then it's important that you work towards losing the weight. Strict blood sugar control. So if you've got diabetes, then of course keep a tight control over the blood sugars that you run, because again, you could eat those things and feel okay. There are complications that could result in the more short time, in the more short time. But in the longer time, we know that running high blood sugars does damages to important organs within the body, including the heart. So again, adherence to medications and yearly checks to preserve your organ functions if you've been diagnosed with the condition. As we know, prevention is better than cure. So if you don't have diabetes, don't plan on getting it. So watch out for yourself. And if you've been diagnosed with the condition, don't just hope for the best. And we are people of faith, Faith, it's either we swing it to the extreme or we don't make use of it. So if you're people of faith, as Pastor has told us, it is God's desire that our body prosper as our soul prospers. So this medication works together with our faith. I like to hear it. Amen. Okay. Next slide, please. Smoking cessation. Okay. I'm not going to ask anybody to put their hand up, but, yeah. So, again, if you don't smoke, please don't pick it up. If you're smoking, do your best to give up. Even if you give up for a day, and those people who have given up for a day, you know that you feel better within 1 day of giving up. Now you can only imagine the health benefit of giving up for a year and sticking to it. More people don't stop smoking because they did it last time and it didn't work more than 2 hours. So it shouldn't be a hindrance for you. So think positively, make a list of the reasons why you think you should quit, and then make a plan. And again, it's not one of those whereby I'm going to win myself off it. So I'm going to do 19 tomorrow and then 18 the day after. Smoking doesn't work like that. You give it up. And the willpower is very important, more important than actually the help that the health practitioner can give you. You're twice more likely to give up if you just decide, I'm going to give up, rather than somebody wanting you to give up. So it should be a personal desire. So if you're struggling to quit smoking, then please seek help. Okay, next slide. Thank you so much. Exercise. So when it comes to matter of exercise, everybody thinks, oh my God, I can't do this. Well, that's what I feel like. My attempt at going to the gym didn't last more than that day. I haven't gone back since. But when it comes to your health, well-being, it's not actually the amount of weight you can carry. It's about walking. So everybody walks. Well, most people walk. So it's something that you should make use of. It's something that you can easily implement into your day-to-day activities. It could be like, parking your car further away from the house or further away from the station so that you can have that half an hour or thereabout activity that raises your heart rate, that gets you a little bit out of breath for about 5 days or thereabout a week. And of course, most of us in the room seem to be within the working class. It's something that you can easily implement around your working life. And those of us who are in the retirement age, again, getting up early in the morning, taking those little ones to the nursery kind of count as well. So it allows you to burn your calories and strengthen your heart and, of course, your entire body as well. So, as you know, you lose it if you don't use it, yes? So more important, even within the elderly group, that you keep moving, you keep pushing yourself so that you can maintain the level of strength that you have at present, and of course to have a better cardiovascular outcome also. Thank you. Next slide. Oh, that's it. It took me by surprise as well. All right. Thank you very much for listening. Thank you. I suppose we do questions later? Sorry. Questions later? Or... You can do some now. Okay. Any questions too? Yes, sir.
When you were talking about hypertension, you said to minimize that, it's best to have a low salt diet or not have salt.
Low salt diet.
None at all.
Low salt diet.
When you say low,
Okay, so how much is enough in a day? Right now we say about 5 grams of salt in a day.
Is that a half a teaspoon?
Very, very, very good question. And I'm so glad that we've got the nutritionist. Look at that. Just look at MDT in action. How about that? I love it. So, 1 teaspoon.
1 teaspoon, 5 grams.
Okay, thank you.
Another catch out is when people come to the hospital and say, I take the brand tablet. the brand tablet doesn't mean a lot to the doctor. Another health tip, make sure you write down your medication when you go into the hospital. It makes your treatment a lot more faster that way. Yes.
When you mentioned the high blood pressure and monitoring that, will the test today, will that give us a diagnosis today or not? I just wondered what sort of test will, it's the blood glucose test, will that tell you what levels is on?
Well, we'll give you a snapshot of your blood sugar level, and the blood pressures will be done as well today, if you will. And again, getting your own blood pressure monitor at home is much more reliable. That's all right. Yes, Dr. Fashi.
The question I've got, clarification I wanted really from the nutritionist or you. A lot of us use seasoning in our foods, not necessarily salt. So how can we sort of work out how much?
Yes. Again, I'll leave it down to the nutritionist. Very valid points, by the way. Yes, and that's what I mean by in the black home. Let me say we use a lot of seasoning, like I said. A lot of them are salt-based, and we need to watch out for these things. So.
Thank you, Dr. On the subject of hypertension, you said it's a silent killer. What are the symptoms?
Well, what are the symptoms of high blood pressure? Majority of the people who have high blood pressure do not know it until they've come in with something, life-changing, like a stroke, heart attack, heart failure, and things like that. So the best way to catch it is to monitor it. At least, those people in the more advanced age, check your blood pressure, I would say 3 times a year, 4 times a year, or thereabouts. Those of us who are still a bit younger, then once a year is just okay. Okay? But main thing is that people don't have the symptoms until, it's advanced. Yes.
It has been said that once you go on blood pressure tablets, that you don't come up. Is that a myth or is it a fact?
Well, once you go on blood pressure tablet, you don't come back, I will say is a fact. Reason being it's not a condition that you get and it disappears. Once you get it, it's more likely to progress, it's more likely to advance. So if you're on blood pressure tablets, of course, there are scopes to go up and down and maybe make changes as well. But in my experience, if you've got high blood pressure, it doesn't go away. So it's important, again, adherence to medication. Yes, ma'am.
Can I see your first slide again, Doctor? Because I missed it.
She likes it.
Also, I have several tablets, and I work towards reducing them. And I'm now on just one tablet, which is brilliant. I need to reduce my weight and watch. I love food. But as you said, in our diet, we tend to actually put salt and seasoning. And the food has already got salts and sugars in them already. The nutritionist, I think, is going to be the person that I need to actually talk to. But thank you very much. You can reduce the amount of medication you take, because I'm proof that that can happen.
Okay, can we? Oh yeah, that's it. You got the first slide as well then. Okay. Is there any risk for having low blood pressure? Yes. Some people have low blood pressure for several reasons. That itself is not a risk for your heart. But having a low blood pressure can have, its toll on his body. Like, a lot of people, they do collapse and black out as a result of having low blood pressure. It can happen. And of course, being on too many blood pressure medication can, do that to you also. Again, the indication for you to work with your GP and find what is appropriate for you. think that's going to be the last question. Okay, yes.
We'll be talking about high blood sugar. If you have fruit and you have sugars from fruit, does that count? Does that part count as well?
Yes, I mean, having fruits, sugars from fruit will be, natural, healthy sort of options. And, I don't think those ones spike your temperature in spikes your sugar, blood sugar, in such extent, okay? So those are healthy options that we encourage people to take. Cane sugar is the problem. Yes, correct. All right. Thank you so much, everybody, for listening. God bless you.
Thank you so much, Dr. Daniel. Could we give him another clap? That was excellent, absolutely excellent. And he delivers it with such great humour. So, thank you, Dr. Daniel. Can we now welcome our GP, Dr. Jimmy Ocker, please? Thank you.
Hello, everyone. It's lovely to be here. I'm just going to quickly answer your question because you mentioned about sugars in fruit. Actually, I get these questions a lot in my clinic, and sugars from fruit is actually good because you're eating the whole fruit and you're eating it with the fiber that is in fruit as well. So the release of the sugar when it gets into your system is actually slower because the fiber is there. What is actually not good is when you squeeze the juice out of the fiber and you're drinking the pure sugar. So that's what is it. All those juice in carton that we buy, they're not good, but eat the fruit rather than the juice. Yeah? What? Yeah. Oh, juicer. Take it back. Take it back. So I'm a GP in Bromley, and I have special interest in mental health and healthcare and self-education. And as a GP, I see average of 40 patients a day. And I would say 50 to 60% of my consultation is actually about chronic disease. And a lot of these diseases can be prevented, actually, or you can prevent worsening or complication of these diseases. And this is what I'll be talking to you today about. The lady there was talking about medication, and part of my job is prescribing, and I prescribe a lot of medication. Day in, day out, with every consultation, at least one out of every 2 consultations end up in me prescribing. And some of them, majority of them, are for chronic diseases, and also the complication of those diseases. Because once you start the medication, often you develop a side effect to them, and then I have to manage the side effect. So the key thing, like Dr. Daniel said here, is don't plan on getting those diseases in the first place. And the second slide, please. Oh yeah, go back. And it's nice that this passage is there. If you take a look at the words, some of the words there, I don't know which one is jumping out to any of you. I wish it was bigger. Balance, life, spirit, peace, education, love, giving. This are the things that are important for optimal health. And if you look at the passage again, beloved, I pray that you may prosper in all things and be in health, just as your soul prospers. So we can see that's the heart of God for us. Our Father wants us to be healthy and wants us to be in optimal health. And part of that is preventing chronic disease. And if you already have chronic disease, prevent worsening, prevent me having to prescribe more and more medication to manage the complications. And this is some of the key points I'll be talking to you today about. And these are the objectives. So Dr. Daniel, I've spoken about some of the key drivers of chronic disease, hypertension, diabetes. Well, they are chronic diseases, but there are risk factors that feed into them, I'll be taking you through today. And I'll be talking to you about 6 key practical strategies, on disease prevention. And these are the things that I wish I have time to talk to people about in my practice, because, we have 10 minutes to see a patient. And often we don't have enough time to even go into the 6 key practical strategies. But when I do, there's been a lot of testimonies and, people coming back to say, I can't believe that simple thing actually worked, and a lot of the time we resort to medication. But these key steps are quite important. They look simple, but if you put them into use, you will see benefit from them. And I will be telling you what your GP can do for you as well, because a lot of people don't know that going to the GP, like Dr. Daniel was saying, and monitoring some of these risk factors is actually quite important in managing. So next slide. Thank you. So as we know, any disease or any condition that lasts more than 3 months is counted as a chronic disease. And all the points on the left, stroke, heart disease, type 2 diabetes, these are the chronic condition that we manage day in, day out in general practice. What people don't think about as a chronic disease, things like depression, dementia, arthritis. I'm seeing more and more younger people developing arthritis, actually, compared to when I was in medical school, for example. And again, once you get some of these things like arthritis, it can be something that flares up, hip pain, knee pain, ankle pain. I saw a chap recently, a 40-year-old, that is already listed for hip replacement because of the weight, just the upper body weight and pushing pressure on the knee, on the joint can lead to arthritis. And I think my slide has been changed slightly because I've put the chronic diseases on the left, which is stroke, heart disease, type 2 diabetes, depression, dementia, and arthritis, and the drivers of these chronic diseases on the right. So from the hypertension, insulin resistance, unhealthy diet, high cholesterol, and all the rest of it are the things that actually drive this disease. And if we are able to tackle those things on the right, then we can actually end up, getting those things on the left. Next slide, please. Right, so we'll talk about insulin resistance first, and because this is one thing that a lot of people actually don't know about. And when I tell them that, okay, your blood sugar is not too bad, it's borderline, it's not abnormal, but it's not normal. It's like in between. I think, okay, do I have diabetes? Do I not? No, you don't have diabetes. You probably have pre-diabetes. And even pre-diabetes is very close to diabetes on its own. But what a lot of us already have is actually insulin resistance, and we don't even know it. Because from the diagnosis of diabetes and the journey, it can take 10 to 15 years. And the beginning of it is that resistance of insulin. So I don't know if any of you can recognize some of the signs of insulin resistance, just being tired, especially after you've had a good sleep or you're still tired, craving sugar or craving more food after you've eaten. You've just eaten, but then you're still craving sugar. This is insulin resistant because insulin is a hormone that drives sugar in your blood system into your cells. And the cells is where we need them, because that's where they need to be converted into energy and work and do what we need them to do. But actually, resistance means you have sugar in your blood, and it's not going into the cell. So your cells are still starving, and this drives craving, and you're eating more and more. Also, trying to lose weight, and the weight's just not coming off. That's one of the signs of insulin resistance, because you're not tapping into the fast storage, because your body, your blood vessels are full of sugar that are just there. The insulin can't take them into the cell, and they're just there wandering around. And the fast cells are locked up. You can't tap into that energy. And I'll be talking to you later about what you can do to actually reduce insulin resistance. Like on that slide is a vicious cycle, actually, because the more you eat, the more insulin you release, and the more resistance you get, and it becomes a vicious cycle until it leads to pre-diabetes and diabetes. So that's one of the biggest key drivers, actually, of chronic disease in the UK. It's an epidemic, but we don't know it because a lot of the time we don't recognize the signs and we're just there until you end up in Dr. Daniel's hospital and, you know, something has happened and they say, go back to your GP and we have to start managing complications. Right, next slide. So hypertension, Dr. Daniel, I've spoken a lot about this. I'm not going to go over it again, but the key point is treatable, actually, very treatable with medication. And actually, I know there was a question asked about, once I start medication tablets for high blood pressure, can I stop it eventually? And I've seen success story of people that have been able to stop, but the most important thing to cutting down on blood pressure medication once you start is actually weight loss and exercise. And I've seen people that we had to reduce their blood pressure medication because we are now over-medicating them after they've lost weight. And, you know, so it's possible, but it's really, really difficult. But, you know, so yeah, next slide, because, can you go back? Sorry. One thing that Dr. Daniel mentioned is the link between hypertension and stroke. And that's quite important, actually, because one of the biggest risk factors for stroke is hypertension. And often people don't know and they end up having a stroke. And then we find out that, oh, they have high blood pressure all this while. And this is why we call it silent killer. Because if you don't know, you don't know. You just, because you also don't have symptoms of them. Later, I'll be telling you about some of the symptoms that people come with me to general practice. And, you know, loss of balance, for example, they're dizzy or tired, and you check their blood pressure and it's high. But majority of people might think, oh, because I'm too busy, that's why I'm tired all the time. But actually, maybe it's signs of high blood pressure. So we'll talk about that later. Thank you. And on healthy dietary behaviors, I mean, we all know this, you know. We have our nutritionist in the house, and you can ask our questions about diet, so I'm not going to go too much into details about it. But one thing I've learned recently, and I'm telling my patient a lot, is liquid calories that we all don't think about, you know. I have my in-laws, they came recently from Africa, and to welcome them, I'm buying the best freshly squeezed juice, apple juice, you know, the sparkling ones, you know. I can't even remember their names now. But he told me, this is a 70, they're in their 70s, they have more energies than us. But he said he's not had fruits, orange juice or apple juice or any of those juices in a very long time. Why is my table filled with all of this? He said, Maltina. I said, why? You know, I eat my calorie, I don't drink them. You know, because if you drink your calories, it increase spike of sugar, and you've already eaten a large plate, and now you're eating another large amount of calorie in form of liquid. So since they've been over, we've not actually bought a juice, and now we're not missing it so much, you know, except maybe for Maltina, but we're not missing those juices so much. So convenience food, liquid calorie, and then binging, which is one of the key drivers of insulin resistance, actually, the binging on food, because we constantly eat. We don't give gap in our diet. We don't allow our pancreas to rest. We're constantly spiking insulin every 2 to 3 hours. So that's so important to be aware of, and I'm sure our nutritionist will also talk about that later. Next slide. So these are the practical solutions when you go to your GP. Oh, how can I become healthy? How can I lose weight? This is what we this is what we're taught in medical school. Oh, tell them, eat healthy, exercise, you know, you have to keep things simple and all of that. Sleep well and all of that. But actually, you know, these things can look so big that sometimes it's unattainable for a lot of people. And eat well, okay, I'm eating healthy already. You know, people would tell me, but doctor, I'm eating healthy, you know, I'm exercising, but I'm still not losing weight, and my high blood pressure is getting worse and all of that. So I just thought I would break it down into micro habits, things that actually drives that drives some of these things that we can incorporate into our day-to-day lives. Like I said, often I don't have time to say this to my patient, but when I do, people do come back and say, wow, I tried that and it worked. So let's start with the number one. And the number one is stress management. How come? Stress management and chronic disease, but actually it's so important. And the evidence is actually in the pandemic that, in the last 2 years, stress have gone through the roof. And stress actually drive anxiety, depression, burnout, hypertension. I have a lot of, in an area where I work, I have a lot of people that work in the city, and they're quite stressed with, trading and things like that, stock market. And you can actually see the more stressed you are, the more likely you are to, your hypertension to go up, the more likely you are to reach out for unhealthy food, weight gain, insomnia because of stress, and people, awake at night and can't sleep. And those two extremes of the stress curve is so important, because there are people that are also laid back and nothing really shifts them and everything is fine. And that's also unhealthy. But we need a certain level of stress as well to function and to achieve things. But when it's too much, it's important to recognize, the underlying, problem that is leading to the stress. And this is what I do in my clinical practice. People come with stress. Sometimes it's work, and we have to sign them off work, okay? Sometimes it's work, and they don't like their job, and you have to encourage, how can you like your job? Can you change job? And, it's so important. If the stress is at home, what are the things at home that you have to deal with that you don't have to sweep under the carpet, that you have to deal with to reduce that stress. So it's so important that stress is dealt with, because eventually it leads your body into all these conditions. Number 2. Right. This is the remit of our nutritionist, but I put Mediterranean diet there because actually there is so many evidence to show that it's the best diet actually in the world. I mean, a lot of people will say, no, vegan diet, this diet, that diet works for me. But actually, if you look at it, incorporate all the good things from all other diets into one. And the main thing is eating whole grain food, increasing fruit and vegetables, very simple, reduction in red meat, increasing fish, protein, as in fish. Well, I will add chicken there for myself, because actually, chicken is important. It's a good protein, it's a white meat, so it's not actually too bad, But the last point there, I don't know if you can see it, is the intermittent fasting, and there's a lot of evidence that is coming up now about intermittent fasting, and I've been recommending it to a lot of my patients in our household. We've incorporated that, and we've seen tremendous improvement in blood sugar control, in weight loss, increased energy. And intermittent fasting is basically not grazing all the time. It's basically leaving a gap in between when your food, your meals, okay? I put 14-10 there because that's probably the best way to start. You stop eating at 8 o'clock at night, and you don't eat again until 10 o'clock. So you've given a good gap in between meals for your pancreas to recover, your body, your organs to recover. Insulin will go right down. Your cells will start regenerating again for them to not be resistant to insulin. It's fantastic. You can read about it and see how you can incorporate it. I mean, if you already have diabetes, I recommend starting with 12-12, which means you fast for 12 hours and start eating for 12 hours. There's a lot of research about this, but you have to read about it and speak to your own GP before you start to fast, because actually some people may not be able to, but I doubt if anybody will not be able to fast, but I don't want to give medical advice against your own GP, so it's important to speak to them. And I think the optimal intermittent fasting is actually 16-8, where you fast for 16 hours and eat for only 8 hours in a day. And if you look online, there's so many testimonies of people that have been able to even stop their diabetes medication just through intermittent fasting. It's fantastic. So try it. I don't know if our nutritionist will support it, but because I know there's a lot of, a lot of school of thought around intermittent fasting. Yeah, next slide, please. Thank you. And yes, so high blood pressure is what Dr. Daniel has talked about a lot. And there was a question about recognizing the signs of high blood pressure. Because we call it silent killer for a reason, because a lot of the time people don't know they have it. But actually there are subtle signs that you can find, that people will come to my practice, and if I don't know about these things, I will just count it as, oh, you're not sleeping enough and things like that. But things like ankle swelling, headaches, sweating, tinnitus, loss of balance, double vision and things like that, they're very subtle. Sometimes it's transient, it comes and you quickly disappear and you don't know. So if you've anything like that, even if you've done your blood pressure 2 to 3 months earlier, go back and do it again. Like Dr. Daniel said, it's so important to have the machine at home, because the blood pressure you've done in your own home is the best, really. And that's how we actually make diagnosis of high blood pressure. We get you to do 5 days reading, AM and PM, over 5 days, and record it down, and then we do an average, and that's how blood pressure is diagnosed, really. But if you any of those signs, it's quite important to recognize them. And the most important modifiable risk factor that I've put there to prevent IBP is actually weight. Reduction in weight is the key thing. And if you're already on blood pressure medication, the best way to cut it down gradually is to actually increase your weight. Reduce weight. Sorry. Oh, God. It's to reduce your weight. Did I put essence? Yeah, it's to reduce your weight, sorry. Next slide, please. Right, now, I thought I'd throw that in there because a lot of people don't know about these signs. Like we said before, many people find out they have a high blood pressure once they get the complication, once they get stroke. So these are the things that is important to recognize, teach them to your children. Not that we're praying and hoping you'll get stroke, but actually time is so important. Once you develop any signs of these things, it's important to get to a stroke center, within 4 hours, the best within an hour, and that actually prevent, complication, long-term complication, long-term damage of stroke. Right, vitamin D, another thing that this actually, I throw it into every consultation because I don't think we talk about it enough. So vitamin D is a fast-soluble vitamin, as we know, is present we need it in every single cell in our body. And it's a key driver. Deficiency is a key driver to chronic disease, actually, and a lot of us don't know about it, especially those of us from, Afro-Caribbean community, because a lot of us are deficient, okay? If I do a blood test that is from one of my people, and I see vitamin D that is above 40, I rejoice, actually, because I thought, how did you do it, without supplement? Because a lot of us are deficient because we don't convert it very well. God has blessed us to protect us from sunlight, from getting skin cancer, from back when we were back home. Our forefathers were back home, but actually, we don't get skin cancer very much. The prevalence among black and ethnic minorities is quite low, but actually we don't also convert vitamin D from our skin very well. So we need to take supplement because actually deficiency in vitamin D leads to tiredness. It leads to weight gain, actually. People don't know because it's an immunomodulator. It helps our immune system actually to function well. Our immune system protects us against cancer, certain types of cancer, because people don't think immune system is linked to cancer, but it does. And deficiency in vitamin D actually drives, all sorts of havoc and chronic disease. So it's important. I always recommend 1,000 to 2,000 units daily. Okay. You can get 100 tablets for like £5 or something like that, including children as well. From the age of 6, I would recommend 1,000 units to kids. You can get it in gums that they can just chew. They don't have to take a tablet if they don't want to. So that's quite important. Otherwise, if you can consume the food regularly, all the foods that have a high level of vitamin D, that will also do. Okay. And the next slide. Right, this is the 5th key point that I have to reiterate to people all the time because it's so important. So circadian rhythm, people say, oh, what are you talking about, doctor? But it's actually our body clock and it's the sleep-wake pattern of our body, and it drives optimal health. That we don't know about. I don't know if you've traveled and you're jet lagged. You feel like crap when you're jet lagged because there's an hormone that we produce, melatonin, and we start producing it from about 9 o'clock in the evening, and it's supposed to put you to sleep, basically. But then if you are in another part of the continent and you are awake, when melatonin is high, you don't feel good, you feel tired, lethargic, and all of that. And if we have disruption to our circadian rhythm in any way, this is how it leads to, loss of balance, anxiety, depression, actually. People don't sleep well because the melatonin, due to the exposure of light in the night, when you're supposed to have darkness, you have light, screen time, TV, and all of that. Melatonin is confused, like, why is there light? It's supposed to be dark. I'm supposed to be sleeping. You're supposed to be sleeping. So it disrupts everything in the body. So read about circadian rhythm and see the importance actually in our bowels. There's a circadian rhythm to our bowels. You see people get constipated because they've been up till 1-2 midnight, and the body clock is disrupted because of circadian rhythm. And now consultation is quite common. They haven't been for 5 to 7 days because circadian rhythm is disrupted. So it's so important for optimal health to have 6 to 8 hours of sleep a night and to make it regular. An hour on and off there, maybe because you have deadlines and things like that. But regularly, if you're going to bed at 9 o'clock, make sure you're in bed at 9 o'clock. And I know it's difficult for some people, but this is, again, what we tell people in terms of sleep hygiene. Because you go to bed at midnight because you can't sleep, and then you sleep in, and that disrupts everything. But actually, how to do sleep hygiene properly is to make sure you get up from the bed the same time every morning, even if you haven't had enough sleep. And then you sort it out the night before by going early. And this will help to reduce stress, reduce anxiety, build resilience, because you are now getting good sleep and your body clock is in a rhythm that's working for you. I can't talk about this enough, but it's so important. And the last thing that, funny enough, a lot of people don't think about again, is engagement in meaningful pursuit in life. And this is so important for a lot of teenagers and young people that I see in my clinic with anxiety, depression, and even a lot of my retired patients that maybe not working anymore, and they start to develop anxiety, arthritis, dementia, memory, brain fog, and things like that, because the idle mind, will attract all sorts of things. And I don't know if you've ever heard about people retiring and then they start getting all sorts of disease, because when you're not engaged in meaningful life activities, volunteering in church, this is why we're so blessed, because we have this avenue to meet up once a week, volunteer, do things. You know, it engages our mind, our body, and even to do more. A lot of the time, our children, you know, takes our time, and we don't have time for any other thing. But what happens when the children leaves home? You know, when they leave home and then you have nothing, you can only clean your house for so many times, you know. So this is so important to engage, because it's also for optimal health. And a lot of people I see during the pandemic, maybe they have been fallen or not working, start to develop disease that weren't there, because now they're not working, now they're home, they're not engaging in any meaningful activities. And I have to tell them, no, you have to have a structure to your day. You have to engage. You have to find a problem to solve. Okay, even if it's a game with somebody else, you have to have a conversation about something. And again, this is so important to prevent dementia, especially. You know, you see a lot of people with sharp mind, because they're engaging, they're solving problem. They're less likely to have dementia, and that's so important. And I think that's my last slide. Oh yeah, the last bit. What can your GP do for you? Health check. So we've been paid. Your GPs have been paid to carry out health check for anybody over 40. Okay, you can have it done every year. If you can have it done every other year. That budget, we don't use half of it. It's just there because, and then we use it for something else that is not as meaningful as picking up people that have pre-diabetes, hypertension, people that are already failing in their memories, you know. So go to your GP, book an appointment for a health check, because you are entitled to it. And even if you already have chronic disease, make sure the annual health check you're supposed to be having. If you are on one medication, you're supposed to have a blood test every year or so, every year. Make sure you have that blood test regularly. Now, because of the pandemic, you can contact your GP by just send a message online through e-consult. Or you can find an email, because a lot of people can't get through to us because so many people are trying to call at the same time, and people hate GPs for that. I can't get through, blah, blah, blah. You know, find their email, put your complaint in, it serves as an evidence that you're trying to call your GP and they're not contacting you back. Do an e-consult, send an email and say, actually, I'm feeling dizzy, I think I need blood tests, I think I need blood pressure checks. Again, if you can't afford to buy a blood pressure machine, although I will advise it, we also have budget, most practices in the UK, to have a blood pressure that you can go to your GP and borrow, and then you take it back within a month, okay? And so you can do that once a year if you want to. So yeah, so just contact us, you know, if you have any concern, even if you're healthy and feel, just know I want a blood test just to check my vitamin D level, to check my, you know, diabetes, HbA1c, very easy to do. So that's what your GP can do for you. And yeah, thank you for listening. Any questions?
Wow, Dr. Jimmy Okoh, wow, one of the best GPs I've sat under. Honestly, that was absolutely excellent. Can we give Jimmy another round of applause? That was amazing, absolutely amazing. I'm so sorry to cut the question time there, Jimmy, because I know we will be here till sun come down, So we can, what we can do in the workshops, if you do have more questions, you can ask them then, if that's okay. All right, because we've got a few more bits that we'd like to go through. So I've got my lovely sister-in-law, educational psychologist, Dr. Danielle Scott. Thank you.
Hi, everybody. Please excuse my notes. This is how I learn, this is how I teach. Lots and lots of notes. So I'm Dr. Danielle Scott, and I'm an educational psychologist, and I work with children and young people from the age, nursery stage right up to the age of 25, once they remain in education. And I mainly work with children and young people, the schools, teaching staff, heads of service, around how do we support their social, emotional, mental health and cognition. And so I'll do assessments and also provide interventions within these settings. So we have, like Dr. Jimmy said, we have seen a real increase in schools around mental health, particularly after COVID-19 pandemic. But also some of that is due to very complex family environments, very stressful environments families are in at the moment. So we're seeing with young people a lot of self-harm, depression, anxiety, and that's been quite challenging for staff to manage. And during the COVID pandemic, I've also had to do a lot of work with staff themselves because they've not been coping. So there's an educational psychologist attached to every school within every borough. So that is a service that schools can access as well as young people. But we have a national shortage in psychologists. So today I'm hoping by the end of this session we'll be able to give you some tips of things that you can kind of implement at home and support each other as a community. Okay, so my aim is to give you a brief overview of mental health, mental illness. It's a very broad subject, but I'll try my best to explore the psychological, social, biological explanations of mental illness. What is the impact of toxic stress on children, teenagers and adults' mental health? And ways we can improve our mental well-being. Okay, so although mental health has been talked about quite a bit now in the media and in our workplaces, a lot of people have had a lot of mental health workshops within their workplaces, particularly due to the impact of COVID-19, it still remains taboo in certain cultures, certain settings. It's not always widely spoken about. And we have to acknowledge different cultures hold different faith beliefs regarding the origin and treatment of mental illness, which is often linked to demon possession or witchcraft. And we have amazing scriptures in the Bible where Jesus healed those who were bound and afflicted. And as Christians, we also acknowledge the spiritual aspects of mental health and believe that God wants us to be well. And there's definitely power in prayer, and I believe in the power of prayer, and I've seen it in my own life. But there's others who have other cultural beliefs which are kind of intertwined with superstition, and this can lead to abuse or torturing those suffering from mental illness. And we've sadly seen that also with the abuse of children and young people who've had additional needs. Another barrier to getting help and support if you're dealing with mental illness or mental health concerns is, as a Black culture, we know that we've also experienced unsatisfactory or inadequate treatment in the mental health services. The data suggests that African Caribbean people are 3 to 5 times more likely to be diagnosed and admitted to hospital for schizophrenia, more than any other ethnic group. And we also had the other data about women not getting the right maternity care, and also mortality rates being quite high in the Black African community. There's also a lack of understanding of different cultures and the way that we respond to stresses and the way we respond to pain. But hopefully there's been a real drive, particularly as psychologists, of ways to improve our cultural sensitivity, cultural knowledge, and cultural empathy. So we're hopeful that that will start to improve. But there's also social stigma. Some people are quite fearful to talk about it in certain settings. Does it mean you have a lack of faith, the fear of discrimination, judgment within your own community? Next slide, please. Thank you. So what is mental health? Like physical health, we all have mental health. This incorporates our feelings, emotions, and mood. It's better to see mental health, I believe, as a continuum. We all move up and down the continuum depending on our genetic makeup, upbringing, life circumstances, and stresses we're under at the time. Next slide. So on one end of the continuum, we have states of positive mental health. That's when you're thriving, you're feeling content, fulfilled. And this is when we can reach our full potential and we can live satisfying lives. On the other side of the continuum is mental illness and disorders. And the most common mental disorders we see is depression, generalized anxiety, obsessive compulsive disorder, and so on. The World Health, next slide, thank you. The World Health Organization describes mental health as a state of well-being where you can cope with the normal stresses of life. You can work productively and you're able to make contribution to your community. The opposite of mental health is mental illness, which is when a person's mental health is disrupted, so their thinking, their emotions and behaviour are affected to the extent that it affects their daily life. So you're not able to function in the school, you're not able to function in work, not able to maintain your home. Children or young people might not maintain their rooms. But it's important to know that many of us will experience moments where our mental health is affected. For example, times when you might be feeling a bit low or a bit depressed. This doesn't necessarily mean that it will lead to a diagnosis or medical treatment. But if the symptoms become severe, chronic, long-term, enduring, affecting your everyday functioning, then you need to get further support for this. So just to give an example of someone who might be experiencing depressive mood or depression, the thoughts are usually quite negative. So it would be, no one likes me, I'm useless, I'm a failure, everything always goes wrong for me. This in turn affects your feelings. So you're feeling sad, you're feeling irritable, lonely, lack of contentment, and then this affects your behaviour, showing no pleasure in anything. Stop doing things that you enjoy, stop going out, meeting up with others. As you can see, as it was looping around, this becomes a negative cycle. So if you've got that negative thought of no one likes me and I'm lonely, then obviously you're going to feel lonely and you're going to feel sad, but then that affects your behaviour because you don't want to interact with anyone because of the way you're feeling, and then that reinforces that negative thought cycle. And then there's physical symptoms along with that: can't concentrate at work or school, not remembering things, never hungry or always hungry, sleeping too little or too much. Next slide. So cause of mental illness, I don't know if that can be seen very clearly, but there's psychological factors, negative thoughts about yourself and others. You might have experienced psychological abuse. There's social or environmental factors, difficult life experience, being bullied, relationship problems, loss of loved one, discrimination. We also have national and worldwide tragedies that can have an impact on us. For example, the Grenfell Tower fire. It's likely that there's going to be a whole group of people who have experienced that, as survivors will experience post-traumatic stress disorder. Also, COVID-19 had an impact on people, and war does as well. And then there's biological factors. If a close relative has experienced mental illness, then you will be at high risk of experiencing mental illness as well. We also find the research shows that neurological disorders, for example, autism spectrum disorder, those young people, as they grow up, they tend to experience mental health concerns around anxiety, depression, or suicidal thoughts. But a major one that I'd like to speak about today is, and that's what I see in my day-to-day work, is adverse childhood experiences. This is the experience of trauma, abuse, constant parent conflict, parent under substance abuse, parent separation, divorce, living with a parent with a mental illness. So let's define toxic stress. Toxic refers to a harmful effect stress can have on mental and physical health. Our response to stress is only supposed to be short-term emergency state, like Dr. Jumie described, increased alertness, but many people's experience of stress nowadays is long-lasting. In order for stress to become harmful, the stressor must be significant to us. The stressor must be either chronic or involves regular periods of severe stress. The stressor is beyond our ability to cope, triggering physical and psychological problems, accompanied by unhealthy behaviour patterns that worsen the problem: not eating, like Dr. Jumie described, not sleeping, not exercising, and alcohol misuse. So we're just going to watch a video to kind of demonstrate how toxic stress can have on the infant's developing brain.
Learning to deal with stress is an important part of healthy development. When experiencing stress, the stress response system is activated. The body and brain go on alert. There's an adrenaline rush, increased heart rate, and an increase in stress hormone levels. When the stress is relieved after a short time, or a young child receives support from caring adults, the stress response winds down and the body quickly returns to normal. In severe situations, such as ongoing abuse and neglect, where there is no caring adult to act as a buffer against the stress response stays activated. Even when there is no apparent physical harm, the extended absence of response from adults can activate the stress response system. Constant activation of the stress response overloads developing systems, with serious, lifelong consequences for the child. This is known as toxic stress. Over time, this results in a stress response system set permanently on high alert. In the areas of the brain dedicated to learning and reasoning, the neural connections that comprise brain architecture are weaker and fewer in number. Science shows that the prolonged activation of stress hormones in early childhood can actually reduce neural connections in these important areas of the brain at just the time when they should be growing new ones. Toxic stress can be avoided if we ensure that the environments in which children grow and develop are nurturing, stable, and engaging.
So unfortunately, during the COVID-19 pandemic, where we was all told to stay home and stay safe, for a lot of children that we see, their environments were not safe. And the safe environment for them is actually better in school. And that's the only place they might be having that warm attachment and a healthy, nutritious meal. We also find a real increase in children who experience that kind of first childhood experience are always on that fight and flight response. So they can be triggered so easily if they're having stress in their lessons, they're out of their seat, they're hiding under the table because it's that kind of reinstates that kind of toxic stress experience. They're running out the classroom, running around the playground, trying to escape the school building, and it's quite difficult for schools to manage. But there's hope. As psychologists, when we're assessing a child, we always look for protective factors. And all of us can be a part of that protective factor or that kind of buffering that stress effect for children and young people. So if you see in the middle there, we've got a child in the middle, but that child interacts with different people and different services and systems. So in that microsystem, this is ecological systems theory by Bronfenbrenner, by the way. So that could be, they might be in a stressful home environment or they're living with a single parent. But what about the impact of being around a praying grandmother, the impact of godparents, the impact of their Sunday school teacher? We all play a very key role in the children's lives. And then we have the exosystem is where they have their interactions at school. Like I said, we will encourage teachers to have that attachment relationship with the child if they haven't had that at home. The breakdown we had during the COVID-19 is the fact that children's centres weren't open, schools weren't open, health visitors weren't doing their visits, and all of you were all in those different roles. It's meant that now, as psychologists, we're getting these really delayed referrals, where I would have seen a lot of children at nursery stage. Some of them I'm not seeing now into reception in year one, and they've not had that early identification and early support. But it's just realising the positive impact we can all make on children's lives to kind of reduce that negative impact and risk factors for adulthood. Next slide, please. So let's look at toxic stress in teenagers, young adults. Research suggests that the onset of mental illness is now becoming younger. It's around 14 or within mid-20s. Some of the reasons for this is that young people are now engaging in quite complex relationships, which they're finding difficult to manage, as well as going through their own hormonal changes, which sometimes puts them more at risk. Some are impacted by exam pressures, the stress and anxiety of coping with the unhealthy expectations placed on them by us as parents, by schools. Sometimes what we're finding is a lot of them are becoming quite avoidant. There's the kind of perfectionist behaviours, wanting everything to look right and seem right, that self-hate, self-harming. So parents, I'm urging you, build that relationship with your young people. Let them communicate with you. Find out about their day. Find out about what's happening for them at school and college. Be aware of changes in your child. What's changing about their behaviour? Are they becoming withdrawn? Are they secretive, not eating around you? Are they hiding away to eat? Are they less talkative? Are they seeming sad, anxious, worried? Do they have negative thoughts or views about school and college, about themselves? Are they missing lessons? Are they not going to school or college? If you notice these signs early, then we can get that early support in. Also, monitor your child's social media use. Social media has been a real big issue. What are they posting online? Are they being bullied online? Are they engaging sexualized behavior online? Are they speaking to adults online, posting about their friends, watching or playing games that are not age appropriate? These are all having an impact in schools. Are they addicted to certain games or social media? Try and enforce social media breaks. Take time to have proper interactions. When young people are in this negative cycle of thinking, that's when they become more socially vulnerable to engage in unhealthy behaviours, such as substance misuse. So we're going to go on to toxic stress in adults. You can't always tell how someone's feeling by just looking at them, because we're so good at putting this face on to show that we're right and everything's perfect. But if there's conflict in relationships between spouses or conflict between a parent and their child, that causes stress. Also, when women are pregnant, they're more likely to experience pre- or postnatal depression. You can be also at risk during menopause. Women are 2 to 4 times more likely to experience major depressive episode during menopause. Workplace stress is a major issue now. Workplace bullying, management setting unrealistic deadlines, increasing workload, then questioning why you're not meeting deadlines, questioning your competence. We now have this issue around leaveism, where you're booking annual leave and you're not actually taking a break. You're using that time to catch up with backlog of work. You're always checking calls, always checking emails. And obviously it seemed great at first working from home and having a work mobile, but it's quite hard to have that differentiation between work and home. Some of us are working in our own bedrooms and the laptop's constant out and you can hear beep and you're looking at the email. We also have presentism. That's the kind of person that's starting work very early and finishing late to prove your commitment to work. You're working through lunch breaks, working when ill. I've even worked in that toxic environment before, where I would have a manager would email me 3 a.m. and I would get into work at 9 a.m. and they'd be like, "Did you see my email?" I'd be like, "What email? It's 9 a.m. And then we can get into that type of culture where we all start to doing this unhealthy behaviours, where you might have people question, "Oh, you're taking a lunch break. You've got a lot of time. You can take a lunch break." Okay. So then we've got other triggers of toxic stress. We live in a very fast-paced society, constantly rushing, constantly feeling overwhelmed, feeling like there's just not enough time in the day to get everything done. We're now in this technology-driven culture, use of technology 24 hours. Technology is replacing things that we would have done mentally. We're not doing those mental arithmetics anymore, doing the calculations with our mind. We're not writing using a pen or pencil. It's all computerized. And even my own daughter, when she went back to school after COVID, she said, "Oh my goodness, some of my friends can't write anymore because they just didn't have that experience at home anymore." There's the breakdown of community structures, the support that we used to give each other, particularly in COVID-19 when everyone was at home and alone. The speed of change in the last 2 decades. I always say to my grandmother, "I don't know how you cope with these changes. It's so much changes all the time, and I feel like I'm not coping with the changes." But that became worse with COVID. Every week, every month, there seems to be a new rule to keep up with. And then there's the worry and stress about finances, paying bills, losing job, people on furlough in the COVID. And then now the global financial crisis. Next slide. So with all the stresses, we have to take time to find a way to maintain our own mental health. And I've got the image there of some of the masks, because it's that kind of analogy of when you're on an airplane, the flight attendant always says, "Put on your own gas mask first before you put it on your children and your family." And the relevance of that with mental health is until you're well in yourself, you cannot help anyone else. So ways to improve your mental health. I don't know if you can see it there. I'll go through, is it all right, sis, to go through a couple? Yeah, thank you. So the first one is, like I described, that negative thought cycle. Replace those negative thoughts with positive thoughts. So if you went for a job interview, for example, and you didn't get it, instead of saying, I'm a failure, I can't go for a next job interview. Replacing that with something positive and saying, actually, I didn't get that one. It wasn't God's will, but I'm going to try my best for the next one. It's also supporting our young people to think more positively. So what I'm finding I'm having to train parents to do in schools is instead, because it's become such a negative cycle and a negative culture, instead of asking them, oh, how was your day today? Is actually prompting them to think of the positives. What went well today? So you've already framed it that you only want to hear the good things about the day. Having gratitude and contentment for what you have. You can practice this every morning by thanking God and thinking of the 3 things that you can be grateful for. I've got life, I've got health, I can breathe. Okay? Accept who you are in God and how he's made you. Set goals, like Dr. Jimmy said, that you can work towards. Have projects, household-related projects, work-related goals. Be organised, plan things. Have a diary, have a calendar. Have things to look forward to, holidays, days out with family, friends. Replace negative emotions, which is excessive anger, fear, guilt, shame, hurt, jealousy, with the fruits of the Spirit. Love, hope, joy, compassion, all the ingredients are already in the Bible. Rely on social support, reconnect with other people. Be positive in your interactions, encourage one another. Don't just talk about all the negatives. Turn your phones off, be present in that conversation. Exercise, like Dr. Jimmy and Dr. Daniel said, half an hour of exercise alleviates a lot of those kind of stress and mental health concerns. It increases your mood, your alertness, relieves all other things. Have a consistent sleep routine. Again, you can see how this is all interconnected, and very much we always kind of look at things in kind of a pigeonholed way. You know, if you're feeling sick, you go to the doctor. If you know something's wrong with your leg, you go and see a physiotherapist. And we've got all these different services and departments, but actually it's one body, and it's all interconnected. So having that consistent sleep routine, withdrawing from technology, having that wind down time, develop self-awareness. What's your triggers? What makes you become angry or sad? Monitor how you are when you're driving, when someone cuts past you. What's your first reaction? Take note when you're talking about certain situations, going into certain environments. What are you like when you're going into work? What are you like when you're leaving work? How do you feel? How's your mood? And I've done a lot of support groups at the moment, like I said, with staff in schools, and a lot of them are saying that when they're now working from home, because they don't have that time of walking away from the office and walking home, that was actually a way of distressing and kind of departmentalising stuff. Where I've had staff who are taking court conferences and talking about concerns about child abuse and stuff, and that's in their bedroom. It's quite hard to differentiate. It's quite hard to break from those work stresses. What's your physical concerns? Are you having headaches? Are you having knots in your stomach when you're in certain situations? Are you constantly fatigued? When overwhelmed, break tasks into small, achievable goals. So have daily lists. If you see my bag, I've always got lots of lists. Ticking things off daily, that actually feels quite rewarding to know that you've got through this and this and this. But you can even do it with your work. So if your work is actually report writing based, I've had to do it myself, is actually looking at your diary and breaking it down to 15-minute increments, and then have another side of your diary that's for reflections. What's made that task take longer? Is it because of someone turning up late? Is it because you needed more time than you planned? It's having that constant evaluation of how you're managing your time. Volunteering, giving back, helping someone who's worse off than you. Don't just focus on your own problems, on yourself. Meditate on the scriptures that we've been given in the Word of God. Time for relaxation, playing instrumental praise and worship, having quiet time with the Lord, going on walks, develop different interests, sewing, doing puzzles, whatever works for you. Be kind to each other. Let your words be uplifting and encouraging. You just don't know what the person next to you is going through. The challenge for you today is choose one or two of those things, and whatever you choose, be consistent. I hope that's blessed someone today. Thank you. Oh, sorry. Just to say that I've got mental health corner over there. But also, if you feel that you need further support, the first protocol is to speak to your GP. I've also got a list of mental health services and charities and resources over there, scriptures that you can meditate on in the week, And those who are willing, it would be nice if we have a range of age groups. I'll be looking at having small group, solution-focused brief therapy type intervention groups, which is looking at how we can support each other's community by looking at the different strengths that we have within our groups and our support groups. Thank you very much.
Thank you, Dr. Danielle Scott. Can we give Danielle another round of applause? Absolutely excellent. Really, really excellent on so many levels. It's excellent. I think they want to clap again. Brilliant. So you can put your name down to join the group therapy sessions that Daniel will be running. It will be 6 people in a group. So we will talk about that after our last presentation, which will be from our nutritionist, Nicola Burgher. You're welcome. Thank you.
Okay, I like to walk and talk, and I like to engage. More so with you all. First of all, I just want to thank Pastor Dennis for having us today. Thank you. Oh, that's okay. I would have. Bless you. I want to thank Pastor Dennis for having us. It's a privilege to stand before all of you and just talk about health. And to be fair, I've been doing this for many years, talking about health, both in the church and working privately. And I've found that the church as a whole, it's not something that's embraced. It's changing, but it's not something that's embraced. But today, it's a privilege to stand before you, and also all of you doctors. I'm just amazed at the skill set today, like my mind is blown. But I'm conscious of time, so I'm just going to push straight ahead. So, in fact, I'll do the slides. Okay, so just a little bit of introduction about me. I am a public health nutritionist. I've been working in the field for over 20 years, but God would have it that I seem to have spent most of my experience, in fact, nearly all of my experience working within the food industry. So the term nutritionist is used really loosely by a lot of people, but in the UK, you have to be registered with the Association for Nutrition, for which I am, so that I can practice and be on the UK register for nutritionists. I have both professional and personal experience when it comes to nutrition. And today, everything's been really said through everybody who's spoken already, but I just want to tie it up. So I stand between you and lunch, but I'll be really quick. So yes, my professional experience, like I said, has been in the food industry. So I've worked for the likes of Muller, Kellogg's, also currently working for Danone, which is the world's biggest leader in nutrition at the moment and foods. And Danone also have a separate compartment where I worked, so the clinical side, where I worked with dietitians to renovate and innovate products. And I saw the use and the value of them through COVID. So tube products and oral nutritional supplements. But the most of my work has been in the food industry. So majority of the products, you must have tasted much of the products that I work to innovate. So I work with food developers and also the government to ensure that the products that come into your homes are as healthy as possible. Food industry is demonized a lot, but we too have a responsibility. And one thing I must say is that the food industry have an agenda, but they stick to their agenda. They're very focused. And I think we can learn a lot from the food industry if we ourselves become focused on our health. So that's my personal, my professional, but my personal is very much, I've seen the value, I've loved and lost. I've seen people, my father for one, die of prostate cancer, and I saw the value of nutrition in his life, and it extended his life for a period of time. So I've loved and lost when it comes to ill health, but I've also seen the benefit of nutrition, which makes me very passionate and a passionate speaker in believing, and I know it works because the evidence shows it, but I've seen it firsthand. So as a result, I became a published author after my father's death, and I published my first book, which is What the Bible Has to Say About Nutrition, because I felt very strongly. One of the things for me was that I was seeing at the church I worship, the altar full of people coming up for prayer for sickness, and that's not a problem in and of itself, but God would have made me see it even more in that it was every week. It bothered my spirit every week, and I felt impressed to write a book. And as a result of that first book, I started touring with it all across the UK and talking to churches. And that was when I was working freelance. And then more recently, during COVID, I relaunched on social media to educate about nutrition in a more, I guess, fun, user-friendly way, trying to be with it, as my daughter would say, trying to get with it as a mum. And then I went on Facebook and Instagram and did probably near 2 years of social media, just educating. So my handle on social media is Nikki Nutrition. Okay. So I just want to bring it home. That's a little bit about me. I just want to bring it home that we are fearfully and wonderfully made. The Word of God says that we are indeed fearfully and wonderfully made. And we've heard it today, and we've seen it today. Just our bodies in and of themselves. We don't really think about it. We don't really think about our health and the fact that the body is working day and night. And what I love about the body and how awesome God is that he has all the systems scream health. Everything is working in harmony. Everything is working in tandem. Screaming health to support health. So that's the body that he's made. It's us as scientists, because first of all, my first degree is biomedical science, then my second degree was nutrition. But my science and working with scientists is very much, it is a masterpiece. They can only testify that it's a masterpiece. But on top of that, there's still so much that we're learning still, from the neurotransmitters in the brain that are produced, to the heart that beats, to the hormones that work, to the cellular level if we go deeper. We are fearfully and wonderfully made, and our body screams health. It's all to support our health while we're on this earth. So we've heard today about the diet and health connection. And no one more than me, I'm going to turn this way slightly because I can see better. No one more than me understands the link between diet and health. God has not only given us this amazing masterpiece, but he has also given us the blessing of food. The gift of food, because it truly is a gift. In food, every single component, not just the nutrients, but the ingredients, work to support that same body, that same masterpiece that he's given us. Everything we eat can either enhance or not the body. From the colours of grapes to the colours of the broccoli that we eat, down to the colour. God is that awesome. That's why I call it a gift. Antioxidants. Berries are not just red because they're red. They have a purpose. Once they get into the body, the phytonutrients, everything working while we're sleeping, while we're sitting here now. The body is alive, working, not just what we're seeing here in the smiles. Inside at the cellular level, so much is going on. And when we eat the food, even more so. As we have our break, we'll be talking about the food and we'll be having a good old chat. The body's doing its thing. And that's why I say everything is focused. The food industry is focused. The body is focused. The food knows what it's doing. The ingredients know where they're going. It's up to us now to be focused on our health. And if I can do one thing today, is just bring that to and remind you that we too need to be focused on our health. Different factors influence our health. We've heard it today, cultural, genetic, everything. But diet is one of, as we heard from Dr. Daniel, you have modifiable changes and those which we can't impact, those which we can't influence. But diet is something that each and every one of us here, from the child, the youngest child, to the eldest adult, we can influence and change the direction of our health or the direction that our health is going in. Eating a varied, balanced diet. So I heard today, Dr. Jumie, you spoke about the Mediterranean diet, and it is indeed one of the best diets. Science has shown that eating a varied, healthy diet. I've heard many diets. I've heard fad diets, the cabbage diet. I've heard the South Beach diet. Every diet, I don't think every name under the sun, there's a diet. And everybody's saying the celebrities are promoting this diet works for them and this and everything. But the key point I want to make today is it's the eating of a healthy, balanced, varied diet that provides us with each and every ingredient that the body needs. It's the best route. It's the only thing we have right now, varied balance, that allows for us to obtain all the nutrients, or as many as possible, that can influence our health. It's the consistent eating. It's not just our health, it's our weight. As we've heard already, it reduces the risk of serious diseases like diabetes. We've heard this already, so I'm not going to repeat. But more importantly, it's about the quality of life that we live, because we can be here, we can be on this earth, but the quality of life, we can be up in a hospital bed, and nobody's saying we still can't have a purpose. But what was the purpose that God intended for us? To be whole, to be healthy, to be well. The verse we spoke of this morning when we opened up, that's what he desires for us, that we be in health. As our body prospers, as our soul prospers. Physical activity, I'm not going to repeat. We all know that physical activity is critical. But these are just some of the key benefits. Maybe some have been touched on today, others haven't. So daily moderate activity is 150 minutes a week that the government recommends, and 2 days of muscle strengthening activity. So just to repeat, 150 minutes a week, which can equate to around about 20 minutes a day, up to 30, as Dr. Daniel showed earlier. And then also 2 days of muscle-bearing activity. This is very helpful for joints and bones. That could be lifting bags. I like to say physical activity, not exercise, because exercise infers the gym or infers something very strenuous. It doesn't need to be. A raised heartbeat. Very important for cardiovascular health, very important for overall health. Maintenance of healthy weight, improved sleep. Also, it manages our mental health, so this is just tying everything together, and it reduces our risk of key diseases as well. But unfortunately, with all these blessings that we've been given freely, beautiful body, awesome, awesome, awesome masterpiece, the food, the air, our diets and lifestyles have shifted. Over time, for whatever reason, they have shifted. And our diets have become, I guess, more unhealthy. Less healthy, as nutritionists like to say. So our diets have become less healthy. We're eating more of the things that we shouldn't be eating, and we're eating less of the things that we should. So, for example, omega-3s, fish. The survey showed that our levels have reduced. And also we're eating more of the foods that are high in fat, salt, and sugar. And yes, the food industry, we do push out foods that clearly you like because you buy them. But at the same time, we have a responsibility to choose which foods and which drinks we eat and consume to support our health. What's become a priority for us now, for whatever reason, is convenience. We're moving so quickly, we can't even wait anymore. We're at home and we have to shop online. We don't get that physical activity. Everything's done, we need it done yesterday. Even the children now, it's got to be done so quickly. No longer do we go to the shops with our parents. No longer we're out riding bikes. Even the society and how it's built, it's called what we would call, as nutritionists, an obesogenic environment, in that we're encouraged really to sit at home and not do physical activity. And this was made worse, I guess, through the pandemic. So all of this, regardless of the fact that we've been freely given blessings, we have shifted and caused our own health, or compromised our own health without realizing. And so today, I'm hoping it's a wake-up call, or it's the start of a wake-up call. So here are some unhealthy statistics just due to this shift over time. Nearly a quarter of children going into school at primary age are already obese. So this is just showing that it's like a mentality. It's now perpetuating to the next generation, and the next generation, and the next generation, until it becomes the norm. So this is saying a quarter, and this is from Public Health Statistics, Public Health England, a quarter of children are obese or overweight by the time they hit primary school. That increases to a third by the time they leave at age 11. We know obesity increases the risk of serious diseases, such as heart disease, diabetes, bone and joint problems, and sadly, premature death. If we look at the bottom figure, 64,000 deaths in England alone are due to poor diet, and those are premature. And if we think of this spiritually, we have then halted our purpose, our destiny, through diet. It just sounds so unreal, but that's what's happened, just through diet. Poor diet is now the biggest risk factor for preventable ill health, and almost 1 in 3 adults are already clinically obese. So we can see the fruits of our actions, and it's now time, I guess, to really review what we do as individuals, what we perpetuate to our next generations and my daughter, and et cetera, throughout, just with our choices. So Public Health England has, you're probably all seen this, it's called the Eat Well. It used to be called the Eat Well Plate, but it's now called the Eat Well Guide, because it was thought that people were thinking, oh, so I have to put all of that on my plate. And so there was a bit of a confusion with the term plate. That's a lot of food to eat. And so therefore they termed it or changed it a few years ago to the Eat Well Guide. And basically, the Eat Well Guide is just a guide to show us what our diet should look like and what foods we should be consuming and in what proportions. If you come to the Nutrition Corner today, if there's time to come across, I would be going through this with you, just to understand where you're at in terms of your diet. I just want to caveat that by saying no one size fits all. We are all different. Everybody has different needs. Our benchmarks now are different. My benchmark is different from mum's, from my daughter's, from yours. We're all different, and so it's very important to be individual. This is national, but in having conversations as nutritionists, we can understand where you are individually. Again, this method of eating is the best way to obtain all those nutrients and ingredients that help support our health, reduce our risk of disease, and keep us maintaining a healthy weight. So today's Nutrition Corner. 2 things we use, and doctors as well use to measure. The first one is body mass index. Body mass index is just a guide, I must stress. It's a guide where we measure your height, and we measure your weight, and that will be done today over in that corner just before, if you're coming to the Nutrition Corner, just to understand where you are. Are you at a right weight for your specific height? I know there are lots of limitations with the body mass index, but nevertheless, it is the guide that we use now for individuals in the UK. In addition to that, we will also measure your waist circumference. No, is that not good? Does nobody want to have their waist circumference? This is all optional as well. Oh dear. Sorry, Cheryl. Wow, that's not great, huh? Is BMI okay though? Is that all right? God. Your waist circumference. And why we measure waist circumference is that because it's a good indicator of fat around your organs. That's what it's used for. And so it's like a screening tool. And both of these methods are non-invasive, and they're really quick, and they just provide us with an indication. Nevertheless, as we've all said today, please do speak with your GP. In addition to the body mass index and waist circumference, that allows me to understand where you are in terms of at risk of various illnesses, and more importantly, you to understand where you are in that sense. And then the plan is to have a 10-minute review of your diet by going through the Eat Well plate. Clearly, there are going to be areas where you can improve, we all can improve, even myself, and there are areas which you've got down, like, hopefully, eating 5 portions of fruit and veg a day, everybody. I'm sure you're all eating your 5 portions of fruit and veg. Okay, well, let's hope so. We'll soon find out. So it's just a 10-minute review, and 10 minutes is so quick. Normally what I would do is have a food diary done before, but conscious of time, and it's just, today we're piloting, and we'll see how we go. But 10 minutes just to talk with you about your diet. and then give you some general healthy eating tips. And I stress general healthy eating because I don't know your full medical history, hence why we say go to your GPs before making any dietary changes. But it's just a guide. It's very much a guide. And as Danielle had said earlier, what's important for me, I remember when my dad was passing and he said to me, Nicola, if you can help just one person, for him, that would be enough. And he had prostate cancer. One person. What I would love for, if you come over there today, is just one thing. It can take up to 12 weeks to form a habit. But if you can go away with just one thing that you can do differently for 12 weeks, that's enough for me. And the impact that will have on your body will be awesome. But just get that down for 12 weeks before thinking, oh gosh, I've got to do this and I've got to eat my fruits and veggies. Oh my God, I haven't got any dairy. Oh, I've got intolerances. Just work on one, focus. And then after that, add on another and another until it becomes lifestyle. But again, I must say, please speak with your GP. I'm sure there's a lot of questions. I've kept it very top line because you can come over to the Nutrition Corner, but I'm looking forward to talking with all of you, if possible, at some stage about your diets. God bless you.
Can we give Nicola another round of applause? Jermaine, I'll leave that to you. I don't want to break the mic. Okay. Sorry. Can we welcome we have a second pastor in our church for those who are visiting today. I can see more workshops coming again, if that's all right with you all. Because I definitely had to cut out my presentation because of the time. It's so much, and I don't want to overwhelm you all. And I think we've been really fed really well here by all these lovely professionals. But now I'd like to welcome our second pastor, Reverend Taylor, and she'll close off the presentation. Thank you. Thank you.
Well, I can say it's been an amazing morning. Thank you so much for the information, the wealth of information you brought to us. We really, really do appreciate it. And I'm sure most of us are going to put it into practice. Some of our lifestyles are going to change. And the bad habits, it's about enjoying the life that God has given to us to the maximum. I always say to people, I'm going to live the full length of days that God has given to me. And if you want to do that, because we don't know how long we have to live, we do want quality life. And so I think everything you shared today has been absolutely amazing, and I'm really, really grateful to help us to just make the best of the life that God has given to us and live healthy lifestyles, because God's concerned about every area of our life. He's made provisions, and it's about us doing what we need to do to enjoy, and not just about ourselves, but to encourage others to get the best out of life and enjoy life, and not be living in the land of if only. If only I'd done things differently when I was younger, if only I'd had better eating habits, if only I'd gone to bed early. We want to enjoy life now where we're at. We can't change things, but we can improve where we are now. So thank you so much, every one of you who've come and given time and shared with us to help ourselves. And we just want to give God thanks for making this moment possible. We want to thank you so much, because in actual fact, you know us better than we know ourselves. And you love us more than we could ever love ourselves. We want to thank you for the enlightenment and the information that we've received today. Lord, help us to be wise stewards of this body that you have given to us. We're concerned about our environment, but if we're going to bring about change, change has to begin with us. In our spirit man, in our thought life, in our health. And so, Lord, if we're not doing the things we should be doing, May today be a turning point, we pray. And we thank you for all these doctors and professionals, medical professionals who've come today to help us to have the body that you have given to us, to keep it healthy, to keep it going, so we can be useful in your service and make a difference in our world. Help us, Lord, to be good stewards of what you placed in our hands and to pass on that good stewardship to our families and friends. So we take this break, help us to use it to de-stress if we're stressed, and to pause and think and rethink. Amen. God bless you. We have some refreshments. Those who like refreshments, we have refreshments in the